So today, I'm going to share this, the use of Flumasil in children. Okay, just now Dr. Belinda already tell you about Flumasil, all right? So let me just recap, the mode of action for Flumasil, okay? It's anti-phlegm, antioxidant, anti-inflammatory, and this anti-biofilm, yeah? All right, so this is the recommended dosage for children. So from 2 years, it is licensed for 2 to 12 years old, of course, but there are usage that we use off-label, of course, okay? Usually, if they are smaller, you can use it like BD dose. I usually use BD dose. TDS if the symptoms are more severe or they are bigger. Usually, my to-go rule is that if they go to school already, like standard 1 and above, and it's easy for them to take medicine, you can give TDS dose lah. But 2-year-old, 3-year-old, 4-year-old, you think it's easy for them to take this medicine? Not so easy, probably 2 times a day will be good. And you should give a duration minimum for 5 days. Same goes for your antibiotics, Do not give antibiotics for 3 days. I know some companies say their antibiotic work 3 days enough, once a day. But actually, a lot of the patients nowadays, 3 days antibiotic once a day doesn't work. You have to give 5 days. So the indication for children is to be used with common cold, any productive cough. You can use it with, influenza. It's a season now, actually. We see our ward is almost always full because of influenza, RSV, adenovirus. Everybody, like somebody will be positive for something every single day, okay? So, let's go and see this patient. I've got 3 patients that came in this year, So, let's just see this one first. Okay, AM, he is 3 years, 5 months. He has 1 week history of fever, cough, and shortness of breath. He has poor oral intake and less active, as usual. Kids come with this. He was tachypneic and tachycardic, okay? Admission, SpO2 is only 90%, 92% on room air, So we quickly put nasal prong oxygen. And when we did the respiratory examination, breath sound is actually good, but a lot of crepitation and there's a lot of bronchi all over the lungs. And with the nasal prong oxygen, 2 liters, the SpO2 came up to 95%. Dr. Belinda is a lecturer, and I'm also lectures. So, we like to ask, who wants to answer? Any of the newer, somebody want to go out already. Don't want to answer. Okay, you see a lot there, consolidation, okay? Both sides, all right? No, that one is not dextrocardic, it's like rotated film. The film is rotated actually, okay? So, he was started on IV antibiotics, nebulized beta-2 agonist, Flumasil, of course. My hospital only buys 100 milligrams, and for this patient, I use BD dose, okay? Of course, I give Montelukast, some cough syrup, and also paracetamol, okay? He was in the ward for 5 days, so he has got pneumonia, okay? And you can see consolidation on both sides on the chest x-ray, okay? So we are able to wean off the oxygen slowly over 2 days, and repeat chest x-ray shows clearing of the consolidation on both sides just now. And I reviewed this patient after discharge, after 2 weeks, and he was completely well, no symptoms at all. So this is one of the usage that we can use with children with pneumonia, right? Okay. Now is the season for mycoplasma and also influenza. Okay, every day mycoplasma, like 8 out of 10 children, we found that the mycoplasma is positive. I don't think it's my lab's error because, a lot of my patients, a lot of my friends, like even in Sabah and Sarawak, they also get a lot of mycoplasma positive in these kids nowadays, especially when they return back to school, after school holidays, after Raya. Terrible. So this ARS is 4 years, 7 months, So he has fever, chesty cough, very chesty cough, cough, and then vomit, okay? Children always come with that, right? Cough, vomit. And then the vomiters, a lot of secretion, a lot of phlegm, right? So runny nose, poor oral intake. So at that time, like really lethargic already because like cough, 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 vomit, and then the pharynx is injected. Okay, lungs clear, no abnormalities in the CVS, the abdomen is soft. Okay, so let's see blood test. Yeah, so HB is alright. 10.9. You see the white cell is already low lah. 3.3 is low for children. And it shows some viral thing going on right now. Platelet is 205, that one is good. Okay, nothing wrong with the BIOS and also CRP, not that high. You see, mycoplasma is already positive and also positive for influenza A. So both positive lah. This one is like normal occurrences in the ward nowadays. Thank God the RSV and adenovirus is negative. Okay, so this boy was started on Tamiflu. Okay, started with Zitromax, okay, and also IV drip lah, as usual. If positive influenza, you start with Tamiflu. Positive for mycoplasma, you can start with Zitromax or Classic. And supportive medication as well. Flumasil, I add on 100 milligrams BD. Some cough syrup, antihistamine for the runny nose and cough. Yeah. So after 3 days of antibiotics, supportive medication, and also Tamiflu, he responded. He was afebrile. Usually they will be afebrile like after 48 or 72 hours for influenza or mycoplasma. If both, sometimes it takes a longer time for them to be afebrile. Yep. So after that, after 3 days, he has less productive cough. The runny nose like sort of slowly cleared off. Okay. And that's another patient of mine that has asthma. Okay, so this kid came out at when he is like 2 years plus, yeah. So initially came to our hospital with cough, fever, shortness of breath. Usually it is precipitated by some URTI or one of those cousins play mercon and bunga api during raya. Okay. And he has this shortness of breath and also cough. Okay, there's also history of previous admissions in other hospital with the same presentation as well. Okay, 2 months prior to the admission in my hospital. Okay, so he is only mildly tachypneic on admission, but a lot of recession actually. Okay. This boy, the SpO2 maintained is more than 95%, but lung examination, equal breath sounds bilaterally, a lot of crepitations and bronchi all over the lungs. So this is his X-ray, mostly bilaterally, perihala haziness and also a bit of interstitial haziness. Yeah. Okay, bloods. HB is 12, that's good. White blood cell for children 15 is higher, and then platelets are normal. And you see that the lymphocyte goes up to 52%. Okay, so that shows a bit of viral thing going on. Okay, CRP is not that high, BIOS is normal. And thank God he has all negative results for all these viral studies and mycoplasma. Okay, so at that time we treat this patient as having bronchopneumonia with bronchospasm. We started on IV antibiotics, paracetamol, nebulized beta-2 agonist, some cough syrup and also antihistamine. Okay, after a few days, he was discharged well with IV antibiotics. And I reviewed this patient again after 1 week after he has completed all the medication. The symptoms actually resolved But again, after 3 weeks, he came back again, another episode of bronchospasm, okay? Because what Dr. Belinda said is true for all ages, not just 72-year-olds. 7-year-old, 2-year-old also must pantang. After URTI, after pneumonia, I will always say, no ice cream, no lollipop, okay, no cold drink, off your cold first, okay, just normal water, like room temperature first, yeah, for like 2 weeks. So it goes for all ages lah. Okay, so at this time, during Raya, play fireworks, the cousin all play, and he got like this shortness of breath. Okay, so at this point of time, the lung examination revealed equal breath sounds, capitation again, and bronchi all over the lungs. Okay, so we take like further history. Why this patient like so young, 2 years plus, has this? And elder brother has childhood asthma. Okay, previously was on MDI, but now no more. And father has allergic rhinitis. Okay. So this time, I treat him as acute exacerbation of asthma already because, 2 previous admission in other hospital, 1 pneumonia and the other one also with bronchospasm, okay, and also a strong family history, right? Another course of antibiotics did him good this time, and also, of course, steroids must be started already lah, okay? In the ward, patient was given nebulized salbutamol, Flumasil, and also Montelukast, okay? He was discharged well after about 4 days this time, a bit severe on the bronchospasm this time. But upon discharge, I started him on fluticasone and MDI salbutamol via aero chamber already, okay? Because after 2 years, usually if they come with recurrent history like this and there's strong family history, every time come with bronchospasm, you check there's a lot of bronchi, then you can treat them as having asthma already. Okay,